So from my previous video, I talked about that I will be doing a series about several causes of chest pain. And from my previous video, I talked about the 4 types of chest pain that should not be missed. Okay? So today I'll be talking about heart attack. Now before I continue, for those who are meeting me for the first time, I am an emergency physician. So I see patients with acute and life-threatening illnesses every day. So this is what I do for a living. So back to heart attack. Now what is heart attack? To put it in a simple way, it means that there is an obstruction to the flow of blood to the heart. So when this happens, you have heart attack. Okay? Now, the question is, how will you know if you are having heart attack or not? All right. So what are the symptoms that you will have? One is chest pain. Okay? So how do you know if this chest pain is heart attack or not? There are some characteristics of this chest pain. So one of them is that the chest pain is described as if someone is sitting on the chest. So it's a kind of tight kind of chest pain, a compression pressure type of chest pain. Okay? And in many cases, it is described that this chest pain, as you are having it in the chest, it appears as if it's also moving to either of the arms, whether the left or the right. Okay? And it can also be described as something moving to the jaw, to the shoulder, or to the neck. All right. Now, when you have this kind of chest pain, the other thing that is very important is that when you take a deep breath or you cough, it doesn't worsen this chest pain. All right. So apart from chest pain, what other symptoms? The person might have shortness of breath, difficulty in breathing, but this is not present in all cases. All right. Now, apart from shortness of breath, the person might also have sweating. The person might be dizzy and all of that. Now, when you have this kind of symptoms, the question is, what should you do? You should quickly go to the nearest hospital, see a doctor. There are 2 bedside tests that can be done. One is an ECG. All right? ECG just means a tracing of the heart. For those who are having heart attack, there's a characteristic pattern that the doctor will see on the ECG. Now, when the doctor combines that pattern to the blood test that was done, which is a troponin test, it gives an indication that you are dealing with a heart attack. Now, if this is the picture so far, the question is, what will you do next? Now, remember that I said that there's an obstruction to blood flow. So the aim of treatment is to relieve or remove that obstruction. Then what do? Ideally, we do a procedure called PCI. So basically, it's just an intervention that they use. Let me describe it this way. Use like a tube, go to that exact part where there is obstruction and relieve that obstruction. Now, once you relieve that obstruction, there is now a free flow of blood. And in many cases, you put in a stent just to secure it. A stent, I'll describe it like you put a small tube in that area so that the vessel does not collapse, or so that it will improve the flow of blood, basically. But in a situation that this kind of services are not available where you are, there are other alternatives. Now, the alternative is to use what we call clot busting medication. Okay? There are some medications that will be given that goes to where that clot is and tries to destroy the clot so that there will be free flow of blood. Okay? Now, having done this treatment, I know you might be asking, what next will you do? There are long-term medications that will be given to you for you to take. Now, these medications will help to thin your blood to ensure that these blood clots do not form again. Okay? The other thing is that some other medications will be given to assist your heart to reduce the strain on your heart. All right. Now, the other question you might have is that, are there people that are prone to having heart attack? Yes, there are. Now, when somebody has hypertension, especially uncontrolled hypertension, diabetes, obesity, sedentary lifestyle, smoking, these things can increase the risks. That is not to say that anybody that does not have all of this will not have. It's just to say that the chances of having it is higher in people with certain illnesses. Okay, so I know you have learned something today. Please like, share, and comment. Remember, I said I'll be doing a series. So in the next video, I'll be talking about other causes of chest pain that you need.